Narcissistic personality disorder has its earliest roots in ancient Greek mythology. According to the myth, Narcissus was a handsome and proud young man. Upon seeing his reflection on the water for the first time, he became so enamored that he could not stop gazing at his own image. He remained at the water's edge until he eventually wasted to death. During the early 1900s, the topic of narcissism started to attract interests of the study of psychoanalysis. Austrian psychoanalyst Otto Rank published one of the first descriptions of narcissism in 1911, in which he connected it to self-admiration and vanity. In 1914, Sigmund Freud published a paper titled On Narcissism, an Introduction. Freud suggested that narcissism is actually a normal part of the human psyche. He referred to this as primary narcissism, or the energy that lies behind each person's survival instincts. In Freud's theory of personality, people are born without a basic sense of self. It is only through the experiences that occur during infancy and early childhood that people gain their egos or senses of self. Another important part of Freud's theory is the idea that the love of oneself could be transferred onto another person or object. By giving away love, Freud suggested that people experience diminished primary narcissism, leaving them less able to nurture, protect, and defend themselves. In order to replenish this capacity, he believed that receiving love and affection in return was necessary. During the 1960s, psychoanalysts Otto Kernberg and Heinz Kohut helped spark more interest in narcissism. In 1967, Kernberg introduced the term narcissistic personality structure. He developed a theory of narcissism that suggested three major types: normal adult narcissism, normal infantile narcissism, and pathological narcissism. In 1968, Kohut first introduced the term narcissistic personality disorder. Narcissism played a role in Kohut's theory of personality, which suggested that narcissism allows people to suppress feelings of low self-esteem and develop a sense of self. In 1980, the disorder was officially recognized in the third edition of the Diagnostic and Statistical Manual of Mental Disorders, and criteria was established for its diagnosis. Although some features of narcissistic personality disorder may seem like having confidence or strong self-esteem, it is not the same. Narcissistic personality disorder crosses the border of healthy confidence into thinking so highly of yourself that you put yourself on a pedestal. In contrast, people who have healthy self-esteem don't value themselves more than they value others. When someone who has narcissistic personality disorder comes across as conceited, they are also boastful and pretentious. They are more concerned with how you appear than what they feel. They are usually seductive and manipulative, striving for power and control. They are considered egotists, focusing on their own interests. They often monopolize conversations and belittle or look down on people who they perceive as inferior. They may have a sense of entitlement, and when they don't receive the special treatment to which they feel entitled, they may become very impatient or angry. They may insist on having the best of everything and being the best at everything. But underneath all this behavior often lies a fragile self-esteem. They lack the true self-values of expression, dignity, and integrity. They have trouble handling anything that may be perceived as criticism. They may have a secret sense of shame or humiliation. They experience life as empty and meaningless because they do not possess that strong sense of self. The exact cause of narcissistic personality disorder is not known. However, many mental health professionals believe it results from extremes in child rearing. For example, the disorder might develop as the result of excessive pampering, or when a child's parents have a need for their children to be talented or special in order to maintain their own self-esteem. On the other end of the spectrum, narcissistic personality disorder might develop as the result of neglect or abuse and trauma inflicted by parents or other authority figures during childhood. The disorder is usually evident by early adulthood.
7 myths about narcissism. 1. Narcissism is really high self-esteem. This is not true. Someone can have really high self-esteem and not be narcissistic. The key difference is that people high in self-esteem focus on relationships, and narcissists are missing that piece about caring about relationships. They only want to know what other people can do for them. 2. Deep down, narcissists are insecure and have low self-esteem. People assume that narcissists must be concealing some deep down insecurity or they actually hate themselves. Even if you measure self-esteem in a subtle, unconscious way, deep down inside, narcissists think they're awesome. It's important to understand that this is a myth because when people act like jerks and they behave narcissistically, often others will say that the solution is that they really need to boast their self-esteem. 3. Maybe narcissists have a reason for being narcissistic. People think, well, maybe narcissists have a reason for being this way. That is not true. Narcissists are just like everybody else. They just think they're great. They're legends in their own mind. If you ask narcissists how attractive they think they are or how smart they think they rate themselves very highly. But when you look at an actual IQ test or someone else's rating their photograph, they're only average. 4. A little narcissism is healthy. But healthy for whom? Narcissism is basically never healthy for other people. It tends to work out okay for the narcissist in the short term, but in the long term they end up messing up their relationships at work and at home, and they end up depressed later in life. 5. Narcissism is just physical vanity. Physical vanity is a part of narcissism, but there are plenty of other aspects of narcissism, including materialism, entitlement, antisocial behavior, and problems in relationships. 6. You have to be narcissistic to be successful. Narcissism isn't linked to success. Self-esteem isn't even linked to success. Why do people make this association? It's partly because we think that self-admiration is always good, and it's partly because highly successful narcissists are highly visible, like Donald Trump and Paris Hilton. But there are plenty of people who are successful in their own fields who we haven't heard of because they don't have their own TV show with money, money, money playing in the theme song. They are just successful. They're just not on TV. 7. You have to love yourself to love someone else. The reality is that if you love yourself too much, you won't have any left over for someone else. Again, keeping in mind that you hate yourself and you're really depressed, you're probably not going to have a great relationship partner either. But people with low self-esteem are perfectly good relationship partners most of the time. They can be insecure, but they do care about their partners, unlike people who are narcissistic. There is no known cure for narcissistic personality disorder, but psychotherapy, a type of counseling, might help the person learn to relate to others in a more positive and rewarding way. Psychotherapy tries to provide the person with a greater insight into their problems and attitudes in the hope that they will change behavior. The goal of therapy is to help the person develop a better self-esteem and a more realistic expectations of others. Psychotherapy can also be useful in getting the individual with narcissistic personality disorder to relate to others in a less maladaptive manner. In a groundbreaking study, Dr. Alexander Lowen uses his extensive clinical experience to demonstrate how narcissists can recover their suppressed feelings and rein in their lost humanity. By the use of bioenergetic analysis, a new possibility of a fulfilling and authentic life is presented for people with narcissistic characteristics and for those who interact with them. Clinical treatment is rare because most narcissists avoid therapy. However, narcissists can learn to be more caring about others, and narcissism can be reduced when these individuals are included in social groups.
Celebrity psychiatrist Dr. Drew Pinsky wrote an entire book about narcissistic personality disorder, a condition in which there is an inflated sense of self-importance and an extreme preoccupation with oneself. But how common is this phenomenon?
According to the American Psychological Association, only about 1% of American adults suffer from narcissistic personality disorder, which is a mental condition characterized by an inflated sense of self-importance and a deep need for admiration from others. Those with narcissistic personality disorder tend to take advantage of others to achieve their goals and have a tendency to exaggerate their achievements and talents. Preoccupation with fantasies of unlimited success, power, and happiness, combined with an obsessive self-interest, tend to characterize the person with this condition. As well, people with this disorder tend to disregard the feelings of others, demonstrating a serious lack of empathy. The former Playboy bunny, Anna Nicole Smith, is a perfect example of classic narcissistic personality disorder, according to Dr. Drew. Like Anna Nicole, people with this condition believe that they're special and unique and should only associate with similarly privileged individuals. Those with narcissistic personality disorder display a sense of entitlement for the best that life has to offer. Despite all of this grandiose behavior, individuals with this condition tend to have a very fragile self-esteem. For this reason, they have a need to be constantly admired and doted upon. It isn't fully understood what causes this set of personality traits, but it's suspected that extremes in parenting may contribute. Many people with narcissistic personality disorder experience the lack of affection and support during childhood. They often report neglect, abuse, or an unpredictable home life. On the flip side, some people with the condition were very pampered as children and were always expected to outperform their peers. No matter its cause, people with this personality disorder do not usually see themselves as having a problem, which makes treatment even more difficult. If a person does seek help, psychotherapy or talk therapy is the preferred method. Psychotherapy may help the affected person relate to others in a more positive and compassionate manner. For narcissistic personality disorder, therapy focuses on learning to relate to others in a more positive, empathetic way. The prognosis, however, is dependent on the severity of the condition. Like Anna Nicole, people with this condition have a hard time developing healthy relationships with others. For this reason, it's important to make an appointment with a mental health professional if you think you or a loved one is affected by narcissistic personality disorder.